Hello everyone, I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eye Care, and welcome to our monthly session, Ask Me, where I answer your pressing questions about eye care. Today's question says, Dr. Mattis, I woke up one morning with two tiny black dots floating across my field of vision. Some days, these dots disappear but reappear soon after. I'm currently experiencing no other eye symptoms, but I did some research and realized that these dots are called floaters. Should I be worried, and should I visit an ophthalmologist to do a comprehensive eye exam? So what are floaters and flashes? Floaters and flashes are a common sight for many persons. A floater is a catch-all term for specks, threads, or cobweb-like images that occasionally drift across the line of vision. Flashes are sparks or strands of light that flicker across the visual field. Both are usually harmless, but they can be a warning sign of trouble in the eye, especially when they suddenly appear or become more plentiful. Now, to understand floaters and flashes, we must first understand the vitreous humor of the eye. So let's look at our model of the eye. Now, the vitreous humor is the gel-like substance that fills the middle of the eye, extending all the way to the retina, which is the light-sensitive part of the eye. So what are these floaters? The floaters, as I said before, they look like small specks or dots or circles or cobwebs or lines in your field of vision. And while they seem to be in front of your eye, they are floating inside. So you might tend to want to get them out of your line of vision, but they are actually on the inside of your eye. So they are tiny clumps of gel or cells inside this vitreous that fills your eye. So what you see are the shadows of these clumps that's cast on your retina. You usually notice floaters when looking at something plain or looking at a blank wall or looking at the blue sky. So the most common cause of floaters is age. So for many persons, it's really a part of the natural aging process. And this actually begins around about age 40 years when the vitreous humor begins to undergo a change in its consistency with a decrease in the gel volume and an increase in the liquid vitreous. So if you will, instead of being kind of thick and jello-like, it becomes more watery. Now, more than half of the vitreous gel is liquid by the age of 80 to 90 years. Now, this degeneration process does not occur uniformly within the vitreous cavity and results in the floaters that are seen as small dots or wispy dark spots of light. So it's kind of haphazard in how it occurs. Now, these floaters can be annoying at times, but you'll notice them less often as time goes by. You may think that they have gone away, but that's not true. They are permanently lodged in your eye and they stay in your eye. So what do the floaters look like? As I alluded to before, there are many ways to describe these floaters. Some persons see spiders, amoebas, or clouds, and your own creativity guides how you think a floater looks like. And what you see isn't actually the floater itself, as I said before, but it's the shadow that is cast on your retina. And these floaters move as your eye moves. They appear to zoom away when you try to look directly at them, as if you're trying to catch them and they just move away. And they drift and stop slowly when your eye stops moving. Your description of floaters might sound completely different from someone else's definition or description. The floaters might look like squiggly lines, or they may look like spots or spider-like shapes, or persons come and tell me they are seeing cobwebs, thread-like strands, small shadowy shapes, or very black or dark spots. Now, your description is your description. It really doesn't matter, and what it looks like does not affect the significance or the prognosis. Now, can floaters happen in only one eye, or do they occur in both eyes at the same time? Your eyes may not age in exactly the same way or at exactly the same time. The vitreous might shrink in one eye a little faster than in the other. Often, you'll have floaters in one eye at a time. It can happen to both your eyes at the same time, but it's usually one eye at a time. Now, when are you most likely to get floaters? Or I should ask, who are the persons more at risk for floaters? Nearsighted persons, persons who are myopic, persons who have had surgery, for example, cataract surgery, persons who have had inflammation or swelling inside the eye. These are some of the conditions outside of the natural aging process where you might see floaters. Now let's talk about flashes. Now, flashes are a person's perception of bright flashes of light, flickering lights, or streaks of light that do not correspond to an external source. So, you may not, if you see a lightning flash on the outside, that's lightning on the outside. But when there's no lightning and you see a flash of light, that's what we call a flash. So a flash can look like a flash of light or a lightning streak when there's no lightning around in your field of vision. Some persons compare them to seeing stars after being hit on the head or being hit in the eye itself, getting a punch in the eye. You may see flashes on and off for weeks or even months. Now, flashes happen when the vitreous rubs or pulls your retina. Remember, in our diagram here, our anatomy of the eye, I told you before that the vitreous fills the entire cavity and it extends all the way to the retina. Now, during the degeneration, the vitreous can pull away from the retina at the back of the eye here. And this is what causes a flash. Whenever the retina is disturbed, it gives off a flash. So that stimulation sends a signal to the brain. And this is what we call a posterior vitreous detachment, when the vitreous is pulled from the retina. And when the retina sends that signal to the brain may interpret the signal as a simple, sudden flash of light that can look like lightning. Now, the floaters and flashes do occur together, and floaters often occur with posterior vitreous detachment. But you can also get floaters and flashes without the posterior vitreous detachment. Over time, the vitreous humor usually pulls away completely from the retina as our normal aging process. Now, less but more common serious causes of floaters and flashes include a detachment of the retina, a tear in the retina, bleeding into the vitreous humor, inflammation in the vitreous humor. And as I said before, flashes can also occur from a blow to the eye or a blow to the back of the head, as I said before, probably because of the stimulation of the part of the brain where vision is interpreted. And just to remind you again, some of the risk factors for floaters and flashes are normal aging, which we cannot change, diabetes, sickle cell disease, high myopia or nearsightedness, and of course, eye injuries. Now, when should I worry about a floater? Now, most floaters and flashes are not really a problem. However, there are times when they can be a sign of a serious condition that can lead to vision loss. These floaters and flashes could be symptoms of a torn or detached retina. And as I said before, this is when the retina pulls away from the back of your eye and the fluid from the inside of the eye then seeps through the tear or the separation in the retina and cause it to separate from the tissues that nourish the retina. And this separation is called a retinal detachment, and this can lead to a permanent vision loss. This is a very serious condition that needs to be treated urgently. Now, retinal tears and detachments are really painless. As I said, the signs are the floaters and the flashes. Floaters and flashes do not cause pain. But key warning sign may include a new onset of floaters and flashes in the eye. Now, if your retina has started to detach, you may notice a gradual shading of the vision from one side, like a curtain pulling over one side of your eye. A rapid or sharp decline in your central vision. Now, this occurs when the macula, which is the central part of the retina that's responsible for central vision, detaches. Detachment can occur from the periphery or it can occur centrally. Now, if you notice a sudden increase in your floaters, contact an eye specialist immediately. Especially if you see flashes as well, or obviously if you start to lose vision. These can be symptoms of an emergency that require prompt attention. Now, how are floaters treated? The most common treatment for floaters is observation, and no treatment is necessary. Even though they can be annoying and bothersome, floaters are usually harmless. They usually drift out of your line of vision and you stop noticing them over time. They can be frustrating for people who notice them a lot and who notice that the eye floaters are dancing across their view, but it's still not a serious condition and it will not progress. What can I do at home to treat floaters? Unfortunately, there are no home remedies for floaters. You usually have to just live with them. What are the complications of floaters, you might ask? There aren't any complications of floaters that are caused by aging. If floaters are due to a retinal disease, your vision can be at risk. They are not serious and they tend to fade and become less noticeable over time. I have to stress that. Severe floaters can be removed surgically, but let me stress, this has risks and is seldom, if ever, necessary. Now, as I said before, as we age, it is common to see flashes and occasional floaters, and they need to be examined by your ophthalmologist. Now, when do you need to see a doctor? As I said before, although most of the flashes and floaters are not serious, if you have floaters and or flashes, you should see an eye doctor as soon as possible because you may have a serious vitreous or retinal disorder. Waiting a few days or sometimes even more may lead to permanent vision loss. You will not be able to know what is happening. You cannot just say, oh, it's natural aging and leave it alone unless you're seen. We have to exclude those serious sight-threatening conditions that I mentioned before. Now, what does a doctor do when you see the doctor? Ophthalmoscopy is the most important part of the eye examination. The doctor first uses a drop to dilate your pupil. Then you sit at a slit lamp microscope and a light with a magnifying lens is shone to magnify the back of your eye, your retina, to examine the retina as much as possible. Now, we usually see the floaters. We can see them very clearly. But what we really are interested in when we do that comprehensive retinal examination is to see if you have damage to your retina. We have to look to see if you have a tear in the retina. We want to see if you are beginning to have a detached retina. So if one of the serious causes of flashes or floaters seem to be possible, we have to take it a step further because you will need further treatment. Now remember, an ophthalmologist is a doctor a medical doctor who specializes in the evaluation and treatment of surgical and non-surgical eye disorders. So I say this to say, when you have these symptoms of flashes and floaters, it is important that you ensure that you have this examination that I just mentioned. You need to have your pupils dilated, and you need to have a microscope examining your retina to ensure that the flashes are just clumps of gel and not associated with any retinal problem. So I hope you understand much of what I've said this morning. And so I thank you for watching, and I'll see you next month for our next insightful session. And remember, if you have a question, just drop them in the comments section below.